guess as acting chair, I'll call the meeting to order.
Sounds good. All right. First order of business tonight, thanks for everybody for coming, first of all, but first order of business is to approve this special meeting minutes from April 2nd. I've provided copies of those, which are really pretty much the same as what the notes were that I circulated that night of the meeting.
About to approve minutes? I make a motion.
I'll second it.
All in favor? Okay, sounds good. Minutes have been approved. So I'll go right into kind of a summary of our activities. It's a little shorter this time because it was only 2 months ago we last met. But anyway, we kind of shift gears come summertime. Seasonal activities, beginning Memorial Day, we collect water samples from our beaches, test for bacteria on a weekly basis. We inspect public pools. We have about 18 of them in town every other week. Seasonal food service facilities, snack bars, and such. We inspect them regularly, permit them, and temporary events, of which there's something going on all the time. The most recent one, of course, was the event up at Oxridge with the horse show, where they have a bunch of vendors there, and we permit them and inspect them. So a lot of different kind of activities in the summer. The Ag Station, Connecticut Agricultural Experiment Station, has resumed testing mosquitoes for West Nile. We have 2 collection stations in Darien. And every year we get positive mosquitoes for West Nile virus, as do most communities, particularly along the shoreline in Connecticut. And to this point, we've never had any individual cases of West Nile virus for our residents. And this year, as with last year, the percentage of ticks found to be positive for Lyme disease and other tick-related illnesses continues to increase throughout the state. And so far this year, the rate of positive ticks in Darien is almost 50%. About half of what residents bring in for testing are showing up to be positive for one of the 3 diseases that the Ag Station tests for. So we have, and we recently did sponsor an event at the library in May called Fight the Bite, where we had scientists from the Ag Station present on mosquitoes and Lyme disease and prevention of those illnesses. And there's a Vimeo, courtesy of Channel 79, that is available on our website. So if anybody didn't attend that session, these guys were fabulous. The presenters from the Ag Station are they're just amazing. And I really encourage folks to watch that if they haven't seen it.
So what was the percentage last year?
It was about, at this time it was 40%. They tend to be higher earlier in the year in terms of positives, and it drops off as the season goes. Last year at this time it was about 40%. This year it's closer to 50%. So we'll see what happens. At the end of the year, last year we were 40%. This time, at the end of the year, we ended up close to 30%. Later in the summer, it seems. I don't know. We still get deliveries of ticks to us, but just for whatever reason, it doesn't seem to be as prevalent. The ticks are infected. Any other questions about our seasonal activities? So we do that while maintaining a regular inspection program for our food service facilities that are ongoing and regular. So we remain current and up to date. We now track viewing of ratings on our website. So we're up over 200 in the 2 months since the last time I reported hits on that particular part of our website. So people use it and look at it. And it is the #1 viewed item on the Darienite, the internet news agency. He comes in every week, gets our inspection reports and posts them weekly. He says that's one of his most popular viewed sites, sections of the site, is the inspection reports and ratings. Mentioned above that, we're doing the inspections and permitting of all the temporary and seasonal events. The FDA Food Code saga continues. The implementation date has been postponed until January 1, 2020, and that remains to be seen. I don't have a lot of confidence that that's going to happen, because we haven't heard boo from the state about training programs or use of form in months. So I don't really know what to do. But what it does do is it delays our ability to update our regulations to conform with FDA code, and Lord knows if it'll ever be implemented. So we're in a holding pattern with that. But that didn't stop us from continuing the discussions with the 7 other health departments that issue ratings in Connecticut, so that we could come up with a uniform approach to issuing ratings once that code is formally adopted. As I've said before, it's going to be a little tricky because the new inspection form does not have a numerical score the way our current one does, so we can't correlate a rating directly to a numerical score the way we've been.
There's only 7 towns that have something?
Yeah, so there's a few districts, but most departments don't have a public rating system in Connecticut. We were one of the first to do it, and I know the public likes it, and it's a good tool for us to try to get compliance and improvement on behalf of the facilities that we inspect, because nobody wants to be identified as having a C rating. So I don't know. It's other jurisdictions just haven't seen the value of it. So it loves to work. The reportable, continuing, any questions about our food program? Comments, suggestions? Reportable diseases. For EMS reports, last month for the first time, since we've been receiving those reports, calls for the post were more for motor vehicle accidents than they were for falls. First time. And we're continue working with EMS to tease out their reporting system to have those incidents where we're out on calls that may have substance overuse or abuse associated with them. For example, falls. They're recorded as falls because when the call goes in to dispatch, what's the reason? And they'll say, well, somebody fell. And so that gets coded in as a fall, but it may be a fall associated with alcohol consumption or something like that. And right now, that's not really being reported. So we want to get a better handle on the substance use and abuse as a kind of a causative factor for EMS being called out.
So it was replaced, is that because the rate of accidents went up, or did the falls go down?
No, the falls were still there. I guess for whatever reason, there were more accidents.
Interesting.
That necessitated calls. I don't know if they just go out to an accident site on a routine basis, or if they go out to an accident call because there's been an injury. I tend to think they pretty much go out anytime there's an accident, just to ensure.
And EMS goes out
Yes.
every time an accident?
Yes.
Okay.
And I'm pretty sure I can't say that definitively.
Okay.
But they also go out 195 for these
They do.
accidents, so, and that road is getting more and more crowded, so is there any way, do they look at traffic patterns and to get a denominator about the motor vehicle accidents per number of cars on the road, basically, or?
Well, I think the question that we would have is, of the accidents, how many are of Darien residents? And of their calls, how many are there? That would be meaningful to us. I mean, if they're on the highway, you know, I don't know how they categorize them, but considering the volume of traffic out there, it's amazing that there aren't, and the way people drive, it's amazing there aren't more fatalities. You know, I dread making the drive. I take the train, you know, and I would dread driving on a regular basis. I don't know how people do it, but lots of them do. I see them every day from the train, bumper to bumper. The other interesting thing that yesterday DPH announced, I said, a new initiative for following up on state lab results, STD lab results. What's new is the video program, which is called Leave It to Us. It's to inform people who may have been exposed to it's when a positive STD result comes in, state health department representatives contact that person and from them get the names of people that they've had contact with who might have been infected with an STD, and then the state health department follows up by contacting those other potential contacts and letting them know, without disclosing who they might have gotten the STD from. The new part is the publicity component of Leave It to Us that tells the world, in essence, that DPH is doing that. So that, you know, I mean, it's the idea is that for those who may have been notified that they have an STD, kind of makes it easier for them, so they don't have to necessarily figure out how to tell their partner that they're infected. Kind of leaves it to somebody else. And ironically, you know, the announcement of this video went out yesterday, and I got called today at 3 o'clock by Channel 12 because they wanted to interview me on it, my thoughts on it. So I had to do a crash course in understanding what this was about, because I knew that this initiative was out there. I didn't really know the details of it, and it's still being kind of worked out because it hasn't been. It's just on the beginning stages of publicity.
But isn't that the way it's basically been done for a long period of time?
Yep.
Is that you go and you get the name, if the person is contacted, you get their names of the contacts, and then somebody outreaches to the other people, potential contacts, without notifying the person where they got it from.
Yeah,
That's the way it's been, I mean, I think, hasn't it?
Yeah, and yes, it is. But how many people in the world knew that? And so, you know, this is an attempt to try to destigmatize, first of all, telling the other person, and also letting those people who do have an STD that this is what they're going to be doing.
Okay.
And it kind of it's to bring public awareness up, and also public awareness up on the fact that STDs are increasing. So this is sort of come on, folks, let's wake up here. We have an issue.
And then this video, where can we get a copy of this? Leave It to Us. Like if I want to show it, you know, on my job to the people I work with who work in those schools, where can we get a copy?
Well, it's going to be. I'm sure it's on the DPH website. Mm-hmm. It's going to be on our website, and I've posted it on our Twitter account.
Okay.
So the announcement of this is on our Twitter page. It's probably the most recent thing that was posted. So you can see it in any one of those 3 places. I'm sure that DPH is going to be promoting this even further. And the Channel 12 is going to have something on it. And I picked it up from also the Stanford Advocate in the Hour. So it is being published and publicized. Speaking of hospitals and...
Excuse me, before that, is that also going to be shown in the schools? When schools
I
close
have
in
no
September?
control over what Board of Ed does, and, you know, we certainly will forward it to them. And
Like
they'll-
a health class or something.
Yeah, and they can decide if this is something that's worthwhile. You know, of course, we do have this statistic that I circulated last meeting that showed that the primary age at which someone contracts the STDs is between 18 and 24. So it's like when you get out of high school. So,
Right.
so yeah, that's a critical group to get, are the graduates, you know, and heading off to college kind of, you know, young folks. They need to be aware, and the fact is, the numbers are increasing, and it's increasing for all types of STDs, not just chlamydia, but syphilis too, and gonorrhea.
And I saw with the seniors, that syphilis is on the rise among the seniors.
Right.
Maybe that's something we should have at the senior center.
Good idea.
Which was gonna look like.
No, I'm fine with me, I think the STD, you've got a huge population in the junior high that have STDs.
Our numbers don't show that.
Well,
I'm just saying, the ones that are reported,
See, they're not reported, that's. the
well,
problem.
they're supposed to be, and I don't know,
I know.
I'm just saying, all I have is what I get, you know, and so, I mean, I don't know the anecdotal stories, and I don't know, because I don't have the direct contact that you might. So, I can only report what I have.
Right.
And, you know, the same issues with Lyme disease, you know, we don't get Lyme disease reports. So, it would look like on the surface that there's no Lyme disease here. But the reporting system has a lot of deficiencies.
Yes.
There's no question about
You're
that.
right, you're right, absolutely.
And part of it is because so much of it is relying on written reports. You know, there's not enough. If we could do everything digitally, I think that, you know, simpler is better. Faster, you know, there's so much to do and nobody has time for it all. That's part of the problem. An archaic reporting system. Any other issues on that? Questions, comments? Stanford Hospital is constantly undergoing the Community Needs Assessment Program, the Community Health Improvement Plan, and as the Health Department representative, I've been on the advisory committee for that group. The assessment of the service area, including Darien, was completed and has identified 3 primary areas of concern: behavioral health, access to health and human services, and nutrition. And the next step, we met today, and the next step is going to be to form 3 specialized committees to develop policies along the lines of each one of those 3 topics that are specific to our communities. So in serving on the advisory group, we're going to be overseeing those recommendations as developed by those 3 committees. As a community health improvement plan, which they are required to submit in order to maintain their tax-exempt status. Works out good for us because we get to examine issues that pertain to us and do some things about it. Emergency preparedness, I had mentioned in the last meeting that the methodology that the state's going to be using for distributing medication in the need for a mass event has changed because this region 1, used to have 7 dispensing areas. We were in combination with Stanford. The state didn't want to try to manage 7 places because they thought it was too much to do, so they want 1 in this area. The only jurisdiction that agreed to provide that role is Stratford, which isn't exactly central to the region, meaning that we'll have to figure out how to get whatever it is that the state ships to Stratford down to us when the need arises, and that's something that we need to get to work on as a region right away. This goes into effect July 1st. So we have some temporary understandings amongst us how we're going to get it, but
How about drones?
that is really probably the best way to do it, seriously, because, with the highway, we dodged a huge bullet when they changed the bridge, because they were able to maintain the flow of traffic even though it was predicted that there was going to be 20-mile backups, which would take it to Stratford. So if we had some kind of emergency event that needed mass dispensing, who knows what condition the highway would be in.
So could they make like arrangements to fly a helicopter from Sikorsky or wherever into the high school football field, or what would they do?
That is all part of the discussion now that we're going to be having a single dispensing area. I mean, it would make sense to do that, yes. And actually, part of the mass dispensing would make sense if even Sikorsky was the place where everything was taken and broken down. But there's a security issue, and there's private property, and there's those kinds of concerns. But their security is probably a lot better than a lot of other places would be. So that's all to be,
In the works.
yeah, it's all to be figured out. This is kind of another kind of breaking news item here with the water sampling program that we were involved with the Commission on Coastal Waters. For 2 years, water testing was done on Goodwives River, kind of as a follow-up to that DNA study that I had talked about in the past, because we knew there's bacteria in the stream. And the advisory commission was interested in trying to work and find out where it was coming from, which we were unable to find. So they kind of spearheaded an arrangement with the Harbor Watch, a concern out of Westport, to do water testing of the outfalls of catch basins along Goodwives River. And they did. They went all the way up. And ironically, the only place they found high levels of bacteria was actually below the sampling point of where I was doing my water testing for doing the DNA study. It was coming out right underneath the Goodwives River Bridge, Goodwives River Road Bridge. There's a pipe that was outletting there, and that had really high levels of bacteria. So there was a few houses up the street trying to figure out, the numbers were not typical of what you would expect plain runoff to be. It certainly looked like it was sewage. And so Public Works, who was part of this group with the commission and the health department, ended up putting a catch basin in another location in front of a particular property to try to get closer to identify where this effluent was coming from. Put a new basin in, and they found a pipe that had water coming in, elevated levels of bacteria. We dye tested the home, recovered dye. So a house, unbeknownst to the folks who lived there, God knows how long this has been like this. It was leaking into a drain pipe that was discharging into a storm drain. So we got involved with the homeowners, and they ended up tying into sewer. And there's a italicized section at the end saying that this was done 2 weeks ago, and they've already noticed almost a complete reduction in bacteria levels in their water that they're recovering. Got it. Just like that. Now, I really did not expect the results to be that dramatic, because I thought that it might take a while for the system to flush out. but apparently it was a direct discharge. That's the only way I can attribute this change.
And the homeowners were still home at that time when, after this was tested, they didn't go away for.
Well, the
vacation
sewer,
or
no,
something.
they didn't go away, the people are there. But the point is that all the sewage being generated in the house, and they ended up having also a separate septic system for the garage. All of that was tied into the sewer, so there was no longer any sewage going into the old leaching system, which must have been installed on top of an old drain that probably when they put it in, they either didn't know about it or they didn't know about it. You know, so this new sewer line has totally taken care of that situation. I'm really pleased
They're
with
still
this.
gonna test a little bit more in the future with that line there? To make sure that that wasn't an aberration, 99.8%, that's gonna stay at 99.8% over time?
There's no longer a source of sewage. Now, as far as whether they're gonna go back and test, that's up to them. But we know that any potential source of sewage from that property has been eliminated. And that was it, that's the smoking gun. You know, we got it, it's been fixed. I'm not sure if they're gonna go back and retest it, they might, but I don't think it's a high priority. I think we've found the problem and fixed it.
Good.
And I think we can say that conclusively. You know, I'm pleased with that because that entailed, you know, cooperation of the agencies here and the homeowners. You know, the homeowners that lived there for years, they had no idea. You know, as far as they knew, everything was fine. And then all of a sudden we come along and say, you've got a problem. You couldn't even tell. I mean, the only way you knew was, you know, down the road, several hundred yards, there was a water sample taken, and that's how it started. So, you know, these folks, I wouldn't say that they were pleased to find out, but they took care of it.
And did they have to pay for it?
Oh, yeah. Oh, yeah, and it wasn't an easy job. You know, there were a lot of obstacles. I mean, you know, it's long. It was a long way from the sewer line, so it wasn't easy, but it got done.
Are they tied into the sewer line now? Or
Yes.
Okay.
It's all done.
Right.
Contractor was good. He finished the job without making a mess of the property, which was one of the reasons why it took so long, was because it doesn't stop raining.
Yeah.
And, you know, it was a long way to go, and, you know, they had to cut through the driveway. So, you know, need to maintain access to the home. So it was a tricky job. But again, you know, I want to give them kudos because, you know, it's kind of hard to convince them. It wasn't backing up in their house, you know.
Who had to speak to them?
Public Works says it's a septic system. It's the health department's jurisdiction.
I see. Well,
So,
congratulations.
yes, thank you.
Things up.
Thank you. And let's see, we had an interesting, on the final page, we had an interesting legislative session. Lots of initiatives regarding local health. One of the primary ones was that a proposed budget cut, which doesn't really affect us because we get no money. You know, we don't get a per capita funding, but it would be potentially devastating to a lot of the health departments in the state that do rely in large part on state funding. You know, and we, as legislative chair of the CADH, we organized quite a campaign to enlighten our legislators as to the scope of services that local health departments provide and why it would be a very bad idea to reduce the amount of money that those departments are receiving. As it is, we're one of the lowest per capita funded states for public health in the country. And Connecticut is consistently rated amongst the highest achieving states in terms of health outcomes. So we're doing something right. The other public health successes for this legislative year, we testified in support of the bill that would raise the smoking and vaping age to 21, and that passed. We did it last year. It didn't make it last year, but finally this year it did. Probably in large part because a lot of communities have been doing that, and it makes sense to have it be a statewide law. We had a tricky situation in that we were, I wouldn't say we were opposed to the reduction of blood lead level and epidemiological response, but to actually respond in accordance with the way the proposed regulation would have mandated us doing that, would have necessitated, in large part, hiring more people and more funding. And so our position that we took as an organization was, sure, okay, fine, we support reduction of lead levels, but you can't expect us to do it with existing funding. You have to increase the funding levels to us. And we provided numbers regarding, the numbers of homes in the state that have lead paint based on the age of the buildings, how much money it would take, how much time it would take. We analyzed the amount of work that departments are doing now versus what we would have to do if the levels were reduced from 20 deciliters to 5. And it was substantial. It was substantial. And, it's hard to say, local health directors are against a proposal that would enhance public health. And we didn't want to do that. But what we wanted to do was enlighten legislators. Okay, you want to do this? This is what it's going to cost the state. And we have to do it that way because if you don't fund it, you can't do it. And that's one of the reasons why New Haven is having some problems right now, because they instituted that program and they are unable to meet the requirements within their own system. So we saw that being a statewide problem. So that didn't pass. The other thing we were opposed to was the approval of recreational marijuana. Recognizing the reality of time, though, with that issue is that it did say, if you're going to approve it, you have to fund programs, educational programs and treatment programs, because we're still trying to deal with the opiate situation and other kinds of overdoses. It's kind of sets an interesting message, sends an interesting message to approve one substance while we're still trying to deal with another. The other thing that we opposed the adoption of the International Property Maintenance Code because, again, it's a matter of funding. And, if the state wants us to enforce property codes, we have to have the ability to send staff out to do that. And actually, the fact that it was directed to health departments was because the state building inspector wouldn't hear of it. And apparently the former state health commissioner did say, oh, we can have the health departments do it. So that bill didn't go forward. The one bill that did go forward that may impact some health departments is one that would require state licensing of eyelash techs, nail technicians, and estheticians. That's a huge thing. We're the only state in the country that doesn't have licensing for those folks. And we did support that bill, and it has been adopted. We'll see how it goes forward. One of the requirements of the bill was for the state and local health departments to come up with a standardized inspection form for doing these facilities, because till now, we developed our own inspection form here. And every health department that does inspection of salons, and not all the ones in Connecticut do inspect salons, had to come up with their own system. of inspections. So now, going forward, we'll see. State is supposed to cooperate with us, local health, on developing those regs. Matter of fact, I sent an email today, because the deadline's October. October's gonna come fast, and this is a big project, so I was inquiring as to, okay, if you're going to do it, let's get started. So it was a busy legislative session. I'm sure we missed some things, but we testified frequently, and the lead bill and the budget bills were big, multiple different types of testimony. And just a couple other things. We have a couple of upcoming events. We are going to be have a table at the farmers market again. We'll be doing that once a month through July, August, and September. Works out well. It gets us some visibility. We do the 3 blood pressure screening. Paula, our public health nurse, will be there. And, give out information, talk with folks, questions, and hang out with the farmers. So we'll do that once a month. And then, finally, on the 24th of October, we're going to be sponsoring an event at the library to discuss the dangers of vaping. Well, we're going to try to get people to come, and that's the big challenge with all these events. There's so much going on in town and around, and everybody's so busy. It's hard to get people to come. But, we're going to work through the schools to try to get this out.
Is this geared towards like parents, or is it geared towards kids?
No, it's geared towards parents understanding the dangers when their kids are vaping, because, New Connecticut law says you have to be 21 to buy any products now. So if kids are vaping and parents know about it, they need to know what they're doing. And there's so many different ways to disguise what's being vaped. And the dangers of what's being vaped, even if it's just nicotine. So it will be geared towards parents.
Do you think it might be interesting if you have a hard time getting people to come to something like that, if it were combined with, like, say, for example, the other legislation related to the new gun laws and safety locks on the guns, and guns in homes being locked up in the glove compartment, because there's some new legislation that was just passed about that, and that might bring in a wider crowd. And there's a lot of, apparently this town is quite well armed, and that people might want to know about, some of that. And if it were a combined thing, it might draw a larger crowd. Like new legislation, health-related legislation.
Now, we were talking about having an event that would be related to the cosmetology salons.
Oh, yeah.
And doing like a presentation on that. I just sometimes wonder if you broaden the scope of what you're presenting, does that help or not? I don't know, and I'm open to your thoughts. Whether you think that having a series of different topics that are varied, like cosmetology, or the gun issue.
I think some of these, I don't know about vaping. I'm interested in vaping, but as far as the guns go, I don't know enough about guns at all. So, but there are certain laws about locking them up, and this Ethan's law, who was that adolescent in Guilford who was killed.
Right.
So that law just got passed. And when you said adolescents and vaping, then I'm thinking about like Ethan's law, 2 things that would be targeted towards an adolescent age group and parents related to that, to protect their children. So,
No, I think that's a really good topic, but I'm not sure you want to mix things. 'Cause I think you just, you do this event on vaping, and what's the downside? I mean,
The downside is that people.
only 5 people come. You just, okay, then we gotta do something else another time, but you try it.
The reality is that I think one of the most important things to do here is to get Channel 79 to film these events, and it goes on Vimeo, and people can watch it. And I've understood and heard anecdotally that some of the events that we've had, somebody said to me, "Oh, gee, I saw that on Channel 79," and I was pleased to hear that. And I guess some people do, really pay attention to the different topics that are covered on the station. So
But you just never know.
you never know. And we did our best attended. We didn't have very good attendance at the mosquito and tick program.
And the which one?
The mosquito and tick,
Oh,
the Fight the Bite. And we sent out notices to everyone who brought in ticks for testing. And the reality is people are busy. It was a nice night too. The weather was beautiful. So I didn't even want to be there.
Well, that's why I thought combining something that may have a larger draw,
Yeah.
people could be exposed.
If it rains, people might come regardless of the topic if they're looking for something to do that night. So, I don't know. I'm kind of, if you have a program, you only have a certain amount of time, and you want to cover it as fully as you can. Now with vaping, we have the police come in, and the police department have compelling stories to tell about what kids are doing, how they're doing it, and what they're finding. And I think that's important to include here.
And that's why I think it would be good with the guns too, because the police would be involved in that, and safety issues related to that. Like a longer program, like.
Well, we only have so much time.
How much time is the vaping?
Well, it depends on how many different perspectives on vaping we want to get. So the concept was to have the doctor speak from Stanford Hospital, have the police department speak, and then a student
Okay.
or somebody who's
That could be like an hour.
Pardon me?
That could be an hour easy.
Oh, it would be an hour and a half.
Yeah. So then
Really to do
if
that.
you add another event,
You can't.
you can't.
So you have an hour and a half of presentation, and then a half hour of question and answer, and you're out of there. It's 9 o'clock.
Yeah.
Because this thing starts at 7, because that's what time the library programs start in the evening. To do multiple programs. Would the police department be interested in doing a presentation specifically for guns, as opposed to the health department? Because we really didn't have anything to do with that. So that wasn't.
Do public health and safety kind of a thing. Right?
Yeah, well, that's
I think they probably would. Being on the RTM, we had a series of meetings we could attend on active shooter training, and it was well attended. And they seem very, very interested in offering that. And I'm sure they probably do that too. But I think that's their purview to do that.
I do too, and I think certainly we could partner with them on that, but that would be, I think, a different program on a different night, in my opinion. Because I think vaping is enough of a problem that I think it warrants the attention for the evening. I don't want it to be another worthwhile presentation. I agree.
But I think you'll get people coming out for it. It's definitely in the news.
It's in the news. The Surgeon General has declared it an epidemic, and they don't use those terms lightly.
Well, working in the school with young people, it's a hard thing because we really got to get to the young people not to want to do this. To draw on the young, because they think it's fine, and they see their parents or grandparents and uncles and all these people vaping, and they think this is just okay.
Yeah, but I
And
don't
these are
think
children, 4th grade.
the data doesn't show that older folks are vaping.
Well, they are up there. Remember, they're like their grandparents may be like, 40 years old. And if they're trying to quit smoking, they may go to something else.
Well, that's true, and that's been, and actually, a couple of years ago, our medical advisor, Dr. Moore, and I discussed suggesting or endorsing vaping as a means of quitting smoking, and we didn't. We decided against. We discussed it, and then discussed it, and I think we brought it to the board at one point, and we decided not to pursue that because of other.
I think a lot of people are under the smell of vaping is not bad.
Yeah, they think it's safe.
Very
Yeah.
safe, and it's not like marijuana. It's not like using cocaine. It's this and that.
It tastes good. I just say it's flavor.
No, it's crazy. Yeah, and you could get a straight shot of nicotine that was far stronger than anything you're going to get in a cigarette. So that's my report for June 2019.
Can I just say something about the foods? For a couple of years, I've been recommending maybe that the health department partner with St. Luke's, where they have the community meal
I did.
on Thursdays.
You mentioned that
And
last
can
time.
that be on the agenda? Maybe somebody work on that for this coming fall for the flu shots.
We certainly can offer that. There's no reason why we can't. I just mentioned it to our nurse, and we can schedule it.
Because there's a big crowd that comes there on Thursday, many of whom don't seem to be all that connected medically, or it's hard for them to get to nurses.
I think that's a good idea. I do recall you mentioned it's on my list of things for the fall.
Thank you.
When is our next meeting? Is it September?
Yes. Should we meet more often?
No.
No,
I didn't.
no.
I just.
No, but it's just time.
Yeah, it just flies. But I was
It
just
does.
September and then
Yes.
November, December.
Yeah, every 3 months.
Yeah.
So yeah,
You can
September's
you
it.
can have a date, or do you want to wait?
I'm sorry.
Will be the second Tuesday in September, or are you going to wait for?
Oh, it's already been
I think
scheduled.
we have to.
Yeah, because Kevin sent out a schedule earlier.
Right.
I'll
It was in the December or January minutes, I think.
we'll.
Well, he throws out the dates. We all yes him on it. And it gets closer.
He doesn't.
I mean,
So, any comments, thoughts, suggestions before we adjourn?
I want to have one thing that I've got numerous calls about, and that is that there's a problem with the dogs at the beach. Nobody's monitoring it, I guess. I shouldn't say nobody. It's not being monitored as people would like. People are still bringing the dogs down, and they're not cleaning up after them, and there's children at the beach, and et cetera, and they're not supposed to be there in the summer. So I can't tell you how many phone calls to please bring it up. That may
To
be
hear?
at the Board of Health, because it's a health issue.
Well, it's a health issue, but it's a policy issue between
But-
animal control, police.
Right.
I mean, I can't,
So- They didn't know if, because it's a health issue, if it would be appropriate for the health department to call and ask the police to look into this a little bit, as far as monitoring the ordinance.
I
don't
certainly
know.
can do that.
Yeah, that's what I think.
Mention the fact that, it would be good if we could have some information from folks directly, if you would tell them to please call us
Sure.
to let us know when this is, so we can get an idea how often this is occurring.
Right. I can't tell you how many phone calls about it. And because they say, you're on the advisory board of health, will you please bring it up? I said, yes, I will bring it up.
Okay, so bring it up, and then I would suggest that you ask them to please let us know directly, so that we could know how many, so we can say to the Parks Department and Police Department, look, we're getting 38 calls
Right.
in 2 weeks on this.
Okay.
Something like that, so that we could quantify it, and say, there's an issue here.
I have a communications question. Somebody had approached me who's on the RTM, the Public Health and Safety, and wanted to know if how they can get better communications from the health department. You send them the minutes, correct?
No.
Do you? Oh, you don't get it. Yeah, because they felt, is there duplication of services?
I
or
actually, I chair public health and safety,
Okay.
and I actually discuss in meetings, usually on my agendas, if there's something pertinent that we've discussed,
So you did
I
that.
pass it along.
You pass along,
Yeah.
yeah, because they said to me they wanted more communications between public health and.
Well, the same thing
So you're
applies.
doing that, okay.
Yeah.
Well, the same thing applies if somebody is interested, if they could let me know directly,
Okay.
or Mac know directly, you know,
Mm.
well, I don't post these minutes, but actually, we do post the minutes. We post the agenda, we post the minutes, and we also post the quarterly reports to the selectmen. So what we discuss and what goes on here and with the Board of Selectmen is on our website.
So we refer them to that.
Yes, there.
Yeah, I think that's an overall misunderstanding with the public, is that they don't realize that all the information that's on the town website, you know, you just have to look for it, but it's there.
Yeah, and we have it directly in the health department section.
Right. Good. And then the last question I have, you know that UV meter for at the beach, are we gonna have that again this year?
No, they didn't work.
And I heard that, yeah, I knew that there was some problem with it, but they're not gonna fix that problem, or it just doesn't work in general, because.
Well, they said they fixed it, but, they wanted to put them up, but I would rather have somebody else test them out instead of having us be the guinea pigs again. Because, as I say, no information is better than the wrong
Right,
information.
right,
And those things just didn't work.
right. Okay.
So I'm gonna wait and hear what somebody else has to say this year. I don't wanna go through that again. It was pretty bad. It was pretty
It
bad.
was a good idea.
Great idea.
A great idea.
Great idea, but it didn't work.
Okay. Thank you.
Okay, anything else?
That's it, thank you.
Motion to adjourn?
Second.
Okay.
Motion
All
carries.
right, great.
Thanks, everybody.